Good morning and welcome to the Gibson Hotel and welcome to this HSE Patient Flow Academy conference. The purpose of this conference is to bring our healthcare staff together to share and collaborate good practices through patient flow and safety, and also to encourage innovation.
Every time I hear the concept patient flow, our heads are always drawn, of course, to the trolleys, to the biggest pressure in urgent and emergency care. And rightly so, we should be concerned for people in that context because that's not just a demand issue, it's not just a capacity issue, it's not just a flow issue, but it is a safety issue. And it's a safety issue at so many different levels. But then, of course, the corresponding challenge of that discourse is that we tend to forget or not have the same conversations about all of the other patient and service user contexts and pathways that also require, and by their very nature, have flow.
Everybody has something new to bring to the table. I think that's really important, and I think Patient Flow Academy equals improvement and quality improvement in patient care and safety, and we're all here for that together.
In terms of planning this and addressing this, people kind of feel unseen and unheard, and I think this is definitely giving a voice to not only patients who, need kind of urgent and emergency care, but also, to the people who are working in the system.
Conferences like this is an opportunity to meet colleagues, to meet peers, to I suppose to learn from the experience of others. And I suppose one of the key things is you'll always take away a few nuggets of learning.
To hear the story of my dad, Pat Janine, and I'm really taking that theme of voice on board and try to give voice to his experience, but also the experience of our family, myself, my mom Mary, and my siblings Sheila, Dennis and Marion, and to share that with you this morning.
As always, it's the patient story. We had a phenomenal patient representative, a service user, and she was able to really clearly articulate the story of her dad. And so, the learning in those stories is just great. So yeah, favourite.
I suppose the importance of interdisciplinary working, that patient flow is everyone's responsibility, and that we identify appropriate patient pathways as early on in their admission as we can.
One of the key things is the communication came through in nearly every presentation that was there, and we definitely saw the collaborative approach and the fact that it is a whole system solution.
And the biggest one probably is in terms of integrating our services that are so interdependent on one another, yet it's not a one-size-fits-all. And I suppose the hope is that the direction we're in now in terms of sláinte care is about moving the care closer to the people that need it and integrating all of our services to ensure that there is a seamless transition of care for all patients.
I absolutely would recommend this event. It's a really great way to connect with both patient stories and with colleagues locally, regionally and nationally.
And I think kind of just the theme of the conference and the way it's been organised and brought to people is just really, I think it's just coming at a time when it just really resonates with people, and it's all kind of coming together kind of in a really kind of powerful way, I think, today.
I'd have to say the message that keeps coming across is that patient flow is everybody's business, and that's really true. I mean, if we're going to achieve it, it means working together, integrating different services, and it can't be left solely to those who have patient flow in their title. It really is the responsibility of everybody working across the healthcare spectrum.
I'm a firm believer that staff are our greatest asset, and I've said that up and down the years in respect to patient flow, and really today has just demonstrated the innovation that exists, the care that exists, the passion that people have for patient flow, and everybody in that room. I know there was a number of prize winners, but everyone in that room is a winner today. I think our staff are fantastic, and they really keep the show on the road, and they get up every day to do their best for patients. That's my takeaway.